Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
Where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to the Men's Health Unscripted podcast with Pat and Cam. And I'm here with a very special guest, especially for Men's Health Month, Dr. Eric Fethke. He's a pediatric cardiologist. He is the host of the Pursuit of Health podcast, and he has a book out, The Privilege of Caring, a doctor's urgent call to heal the U.S. healthcare system. I was on his podcast a little bit ago, and we just felt like we needed to talk about the heart a little bit more in detail than we have previously. So, Dr. Eric, thank you so much for coming on the podcast, and I'm really excited to dive into heart health. This is something that's near and dear to my heart, for lack of a better term. Just excited to learn more about heart health and heart health prevention, things like that. So, kind of how did you get into cardiology? We'll start there, and we'll just get into the facts.
Well, thank you for having me come back. We definitely had a lot of conversations, and we're thinking the same way after we had first met. So I'm glad to continue the conversation, and thank you for giving me the opportunity to do so with you. So I started out as someone thinking about general pediatrics. You know, that was my main goal. But as I was training, as with many of us in healthcare, you find a mentor, somebody who kind of jives with your sense of what a doctor should be and the kind of practice you might want to do. And so I had many mentors at Columbia, a program where there was a strong, and there still remains a very strong pediatric cardiology program there with a long legacy in New York City. And a lot of the mentors I saw there, the way they practiced, the combination of the hands-on care, the primary level of it, prevention, all the way up to kind of the technology and the invasiveness, and kind of it combined everything that I was seeing as elements important to me, the ability to have a relationship with patients for a long time. So the field follows patients. I just finished looking at a baby at 30 weeks gestation, a baby inside mommy, to make sure that because mommy had a heart condition, that the baby also didn't have that. And the mom's a patient of mine. So that kind of continuity of care all the way to geriatric patients who were born with heart conditions now that we still, as pediatric or now congenital cardiologists, still follow in procedures, sonograms, and continuity of care. It just made sense to me. It combined all elements of that arc of life.
That's really interesting too, and we kind of talked a little bit about it off camera, is how the advances of heart and cardiac care have come, and very recently. I think it's every year it's like doubling, right? And
Right.
it's so interesting to hear you say you're, traditionally a pediatric cardiologist, but you're seeing geriatric patients that have survived these congenital heart diseases and potentially been able to live relatively normal lives.
Yeah, I think you're right. It kind of at one point somebody said to me, I don't know why you're so interested in policy issues, which you and I have been talking about. Why are you as a physician in getting involved in policy? And then we started talking about what I do, just like you asked. And they turned around, and I think it was the first time it kind of hit me too. They said, "I get it. I get you now." And I said, "Why?" "I know why you wrote the book, why you're involved in policy issues. You're seeing that whole arc of life again. You're seeing it before birth all the way into geriatric level. Therefore, for your patients, which is a very unique aspect of not many fields can have that long time to get to know a patient or see the implications of what is done earlier in life and what the effects are later in life." And I said that perspective makes you think long term by definition. And so along the way, anything that affects your ability to care for them, you're going to see the impact of that because you continue to follow them. I think when you kind of have a silo of time of life and you say, okay, now I'm handing you off to someone else, you may not realize that. And I think it's true. Eventually it's kind of, it was interesting to have somebody else's perspective on it and say, now I know why you think long term. That's how you practice.
It's interesting to see it now being in my practice, and just my own life, but the level of care you get over your lifetime drastically changes depending on what decade of life you're in, right?
Yeah.
Like being on parents' insurance, being on work insurance, not having insurance. Maybe, there were some periods of time where I was in my 20s where I didn't have it. I couldn't afford it, and it just wasn't offered by my job. And so then you may have to learn about cash pay. You may have to learn about different aspects of healthcare that we don't typically think of. And when we start seeing this kind of continuity of life, like you're talking about, it's very interesting to see the different levels of care people get over time. And then even as patients age and become seniors, their level of care may change for the better or for the worse. And
Right.
it's kind of scary. A lot of my clients are seniors or getting close to being seniors. And you see how sometimes people just kind of start to dismiss them, even in the healthcare system. Well, they're getting old. It's just age, right? And these are just the kind of things that they're being told, where, which kind of like lead us into the bulk of the podcast. But there are preventative steps that you can take even in your old age or as people age. I mean, there's never a bad time to start, right?
Right. Yeah, and I think one of the stories that comes to mind that you make me think of is when I was in training as a cardiologist. There was another cardiologist that came who was working in Washington and was a policy advisor, think tanker, which I've done some of that work now. And at that point, we said, well, why did you go from being an academic pediatric cardiologist to doing policy? What was that about? Why are you in Washington trying to fight this? It didn't make any sense. And then they said specifically, well, I had a patient. It always comes down to that, who I had literally kept alive and was doing tremendously well, but was on several medications and needed routine care. And, they were still under the care of their parent at that point. And I had spent, an inordinate amount of time with passion and would do it all again. But this young man all of a sudden aged out of that age group, pediatrics, and went on into the adult world, and not only under the care of adult physicians, but lost their insurance. And when they lost their insurance and tried to find other ways to get medication, this is before the Affordable Care Act and some of the changes that were going on since then. All of a sudden ran out of those life-sustaining medications, and within months of leaving his care, he said that young man had died. And it just struck him that what was it all for if that were going to keep happening? He had to do something. He couldn't let that happen again. And he knew that he had to get involved in policy, because there was that transitional point that was a huge, dangerous chasm for his patients. And if he was doing all that work up front, it made no sense. And you see that over and over again, and you're right, at different ages. And I think we've got these artificial gaps in our healthcare system between, maternal care, pediatrics, this void of, oh, you're young and you're healthy, you probably don't need much care. We saw that issue. Do we cover young people or not? And are they under their parents? Are they not? How do we do that? And then they start going into employment. And will their employers cover them or not? Now they start to have families. Now they start to need care themselves. These are all silos we've created, but they're not really, that's not how life works. It's a continuum. And so we've created an artificial structure around a life when it comes to the way we deliver care. And it's really, it leaves very important periods of vulnerability, particularly if you're born or have any type of chronic illness.
Sure. And I mean, that's a great way to kind of lead into our next point. Is heart disease is the number one killer of Americans and probably people in the world, especially in the Western world.
Yeah.
I believe the latest statistic is around 800,000 Americans a year die from heart disease, which is, massive. And both men and women are definitely affected by this. Men, it affects them earlier, and this is a men's health and podcast. And I think a lot of these prevention tips and things are going to apply to everyone, but we're focused on the guys today, and especially young men, and encouraging the importance of taking care of their heart. So, what are some preventative steps that young boys can take? I know we've had periods of time where young men in the NFL lately and young men just playing sports will have some cardiac issues. I know when I was in high school playing baseball, you would hear about a kid at another high school who fell out during training camp or something like that, with a heart attack or some kind of issue. So, what are some preventative steps that young men can take that can really last the rest of their lives and lead to a healthy heart?
And I think that's an excellent question, and one to put in perspective. Every 30 seconds in the United States, someone's dying of a heart attack. And we're not even talking about it, but it is the number one killer and number one disease in our society. And surprisingly, only about half the people surveyed recently knew that. People focus on cancers and other things. And it did get worse during the pandemic. There was a bump when we were making so many improvements in heart attacks and heart disease care, but it got worse when we kind of lost access to healthcare during the pandemic. So it's something that's not only treatable, but it's also vulnerable very quickly to breaking away from preventative and regular healthcare services. The moment that is jeopardized, the incidence goes up. And men are 5 times more likely to die still than women of a heart condition, and they do so earlier in life. But then as time goes on, you find that women eventually they could catch up later in life with mostly stroke and heart disease. But the problem is that it's affecting men earlier, and at times when they're still fairly productive. I would say at my age, I'm the average, 65 maybe a little older than me, but this is where the bulk of this happens. So with the perspective we talked about, you bring up 2 different categories. One is the blood vessel or heart vessel cholesterol, hypertension, heart attack kind of group, stroke perhaps, but more in men, heart attacks than stroke. And then you talk about the sudden death risk of young athletes or young people, not necessarily just athletes, but young people. And those are 2 different categories. And I try to make sure that my patients understand they're different. And when I talk to the boys in particular, because it is something that will affect them earlier, I also try to encourage them. The third kind of piece of that is encourage them to be proactive. As a pediatrician, I have to give credit to my biggest partner, mothers. Okay, they're the ones who are out there driving healthcare. That's been proven over and over.
Absolutely.
Women make up the bulk of healthcare workers. 3/4, 2/3 to 3/4 of people in the profession are women. Well, there's a reason for that. It's also moms who are driving healthcare. I even if I get lucky enough to have a dad bring a kid to me, they're always on the phone saying to their wives, what was going on? What was that? Let me check with the boss. The mindset is such that the men are showing a model to their sons that, you rely on women for healthcare. And I'm trying to turn that around, because I think that's a big part of why men are vulnerable. They are not necessarily taking control of their health. And then if the number one killer, the number one condition, heart disease, is going to be impacted by the fact that they're not being proactive. So I think you have to just start with a mindset of teaching young men, either modeled by their mothers, teaching them, and I'll turn around and say, see what your mom is doing, young man? Yeah, it's your job. Don't rely on your mom for the rest of your life or some other significant other in your life. You need to do what she's doing. She's doing it to show you a model, not so that you rely on her. And I know that sounds oversimplistic, Patrick, but I think it's a very basic start. Become proactive, have a mindset for men to change the way they think about their health in general. Once you do that, then you can start to dive into those other things. And when it talk about, heart disease later in life, 50s, 60s, what we call blood vessel disease, strokes and heart attacks. Well, you can talk about hypertension. You're talking about cholesterol and nutrition. You're talking about obesity in childhood. You're talking about men being less active as boys because they're on social media. They're on these things. They're not out being physically active anymore. All these things are impacting their health. That's not proactive at all. That's a very passive all those things are very passive. So getting them to be proactive about their health is very important. And I think a lot of doctors treat disease, but don't think about, what can I do to encourage that young man to take control of their health, and basic things such as health care. Can I basically get them out there so that they are exercising more, making sure that they're making good choices in what they eat, making food choices, not always having somebody else do that for you, regular exercise, making sure that you go, you ask questions yourself at your doctor's office about your blood pressure, your sugars, really starting to engage in the things that are the precursors to this intense amount of heart disease earlier than women, and could be prevented if we're basically eating better, exercising better, sleeping better, watching our weight, being more, proactive in our care. It sounds almost too simplistic, but nutrition, exercise, lifestyle approaches take a mindset that I think we have to instill in young people, and young men in particular, so that they are not facing a heart attack in the prime of their life. And that's
Right.
really the main issue. Then it comes to sudden cardiac death issues, a sudden arrest that we hear about in young people, and that's even younger. And we talk about 35 and younger. And I'm very involved in that work at a national level and at a state level to try to raise awareness and create systems of prevention, and working with parents who've lost young people that way. And I think that is a whole category in which it takes the whole village, the whole family, to be proactive. And again, I see mothers often being the one in the family saying, okay, we had somebody in the family or somebody in the community do this, and I'm going to check my kid and my family and maybe my nieces and nephews. There's always a champion in the family who does that, and it's always a woman. And I think what we have to do is kind of, I say it to the guys on purpose, I want to embarrass them. Guys, step up, man. What are you doing here? Why are the women always the ones who are championing this? It affects you. It affects you earlier. You're the one that out there. Untie that umbilical cord, literally, and be a man, so to speak, and get out there and take control of this situation yourself. And that means knowing your family history, which is a big issue. Are there genes or genetic abnormalities or other people in the family who've had heart muscle disease, heartbeat or heart rhythm disease, we call arrhythmias, people with stretched blood vessels, aneurysms, congenital conditions. These are the things that can place someone at risk for a sudden event. So know your gene pool, know your family history, not rely on mom to do that or your aunt or somebody to do that. At the same time, if you're having some symptoms and you're not sure, mention them to your family, mention them to your coaches, be part of that. I would even dare say to the coaches who are often men, do what your mothers and wives would do, and say, you see a kid on the field, don't always be this rah guy and say, oh, it's just push through it. Use a little common sense here and say, wait a second, that could be a warning sign. Let me make sure that kid is safe. Not have to send the kid home and the mom goes, what were you doing with my kid on the field complaining of X? How come you didn't do anything? So I think that awareness of how these symptoms present when somebody is active, whether it's playing in a band or being on the field or doing gym class, recognizing the warning signs such as chest pain, dizziness, heart racing, having trouble breathing, particularly when you're active or under some type of adrenaline stress. Recognize those signs and then be proactive. Don't just ignore them. Say it's fine, it'll go away. Put the kid back on the field, or don't. If you're the boy, tell someone this is going on so that they're aware of it. Your coach, your teachers, your parents.
Sure. And I mean, we're in Tampa, Florida, and it's hot right now. I mean, it's ridiculously hot, and it always is in the summertime. And this is kind of it's a kind of a sports town. I mean, a lot of kids play sports here, organized sports. There's travel baseball and things like that, and they're playing all throughout the summer. I've coached in this league. I've played in these leagues, and it's really crazy because you almost hear every year someone in this area, like maybe Tampa Bay, not directly Tampa, but maybe just the Bay area around, there's a kid at a high school that falls out during practice, or I don't know if they do Hell Week anymore, but we used to when I was a kid, where it was like the week before tryouts was straight up conditioning, and it sucked,
Right?
right?
Yeah.
And conditioning is great. I mean, you need it to be a good athlete, because that's mental, your mental toughness and physical toughness on the field really are dependent on your conditioning. So, we're not saying don't condition. I really appreciate that you say that, is like to have the coaches take time to realize, you don't have to be a doctor to know when the kid's, chest is hurting, or they're sitting there wobbling around. I mean, you got to get them off the field, get them in the cool air, and like do something about it. Um, and it's not this whole point to just push people over the top. I mean, there's a certain point where it's got to stop. But I mean, I think it's been a couple years now since like I've heard of the last one, but I mean, there's kids that fall out in this heat. And, the other aspect is too, is if you are an athlete or you're the parent of an athlete, they need to be hydrating and taking, and it's not like oh, I'm going to drink water 30 minutes before practice and
Mhm.
everything, I'm hydrated. No, if you're an athlete, and I used to tell my players this all the time, I was like, your baseball game starts the night before. You're hydrating, you're making sure that you have enough electrolytes, you're taking care of yourself. It's not just, oh, I show up at the field to play. There are steps that need to be taken days in advance of a game or some type of competitive sport in order to be
Yeah.
prepared and to feel good about that.
I think that's an excellent point. Is the idea of knowing, how do you know that something, it's a common question that's asked me as a pediatric cardiologist, how do I know that my pain and shortness of breath, my racing, is okay out there on the field if that's happening? A parent will ask that. Again, often a mom. I want the boys to ask. And the boys are often concerned about, well, particularly, let's be honest here, in underserved communities where you may have an athlete, a young athlete, where for them that could be their way into a school that they could never afford before, and stuff like that. So you're getting a lot of these issues where there are other socioeconomic factors that are pushing these young men many
Hmm.
times to ignore their health. And often it's not, surprisingly, that's the group with the least resources around them who are most vulnerable to suddenly having the event. And everybody goes, what a shame. Their future was in front of them. They were going to, finally go to school and be the first one in their family to do so, and da da da, and they didn't make it. Well, because they weren't telling the coaches what they're feeling, because they were afraid that they would not be able to play, and that all the implications of that, and that they may very well not be in an environment where the structures around them, the infrastructure around them, is geared to recognize the warning signs. So you've got all these double whammies going on, and these young men are particularly vulnerable to this. Yeah, and issues of socioeconomics do play a role in that. They are more vulnerable. So how do you do this? How do you know the difference? Well, two things I say basically is, if you're feeling something when you're first starting your sport or you're doing something, if it's really just conditioning and you're just out of shape and you're trying to do that, it's going to get better with time. Your symptoms are going to improve as you condition yourself. If they're not getting better, or they're even getting worse, stop. I mean, it sounds so basic, but the truth is, if it's a serious condition, often it will continue to be present, these symptoms of heart racing, dizziness, chest pain, maybe passing out, really having trouble breathing, and it won't be getting better even though you're trying to condition yourself. Okay, common sense. So say, coach, mom, I'm pushing myself out there, but it's not getting better. Okay. Number two, don't go out as gangbusters right away. Work your
Hmm.
way up. As you said, start not just the night before, but if you're about ready to start your season in any sport or whatever, if you're not all season long doing something, or you're changing the type of sport, start working out before that at home. Do something with some friends, with coaches, something to get yourself ready, so you're not sitting there competing with the rest of your peers to try to get a spot on the team and going from 0 to 1,000. Just don't do that. Don't put yourself in that situation. And I'm feeling if you do that, you may find out that, wait a second, I'm home and I'm feeling something. This is unusual. I can't breathe. I might have asthma that I didn't realize before, or something else that could be serious. And, therefore it's not being masked by, well, oh, you've just been out of shape in the summer. Now you're pushing yourself. Well, don't put yourself in that scenario. Do it beforehand so that if there's something there, you can pick it up before it's kind of muddied by, is it just that you're out of shape or is there really something serious? If you build up gradually, you're going to pick things much better than if you try to go from 0 to 1,000.
Sure. And a little bit of a sidetrack too, but we've continued to bring up the moms here and what a impactful role they play on healthcare in the system and healthcare of their children and healthcare of their husbands and fathers. It's something that we've seen so much being part of this podcast for about 4 years now. And even some of the people that we've interviewed, and you've totally reinforced this concept, but we've interviewed cancer survivors and people who have had some kind of chronic diseases that have had to work through it, and we've really developed a nice support system for men if they're looking for some type of resource of what to expect, like if you're going through a cancer diagnosis and things like that. We've definitely got those guys in the catalog, but almost all of them on the podcast will openly admit, yeah, Joe Forelli, very good friend of mine, he works on the podcast at times. He had testicular cancer, and he said it on his interview with us when we first met him, was he had just this awful pain in his testicles, and they thought it was torsion, and he ignored it. And it got to the point where he was completely debilitated, and his mom's like, dude, go to the doctor. Like, this is not just a typical issue. And we've had other people and other men on the podcast who have said, my mom or my wife made me go, and it turned out I had this type of cancer or this type of disease. And if it wasn't for the wives, moms, girlfriends, sisters, these guys might potentially be dead or kind of debilitated. Right. I mean, they were lucky enough to have these women in their lives push them into healthcare. So I always thank the moms and the women that really push men to be healthier. It's
absolutely,
so important. I'm glad you're reinforcing it, but also saying, guys, this is a model. Take this and run with it, because that proactive nature, your mom's not always there for you, especially as kids grow up. And I would tell, my players too, I'd say, hey, your parents aren't always going to be here. Like, you're going to go off to college, you're going to grow up. They can't be over your shoulder, right, all the time. And so that's why it's so important to be proactive.
I think, as a pediatrician, seeing a mother who's pregnant, all the way to, having their kid who's still in their 20s in college, who has some type of heart condition or might have a heart condition, you definitely see a very different philosophy and approach from the women, from the mothers. And I absolutely agree. I think that is a huge resource, but one that we put the burden on the women to carry. And I think that kind of is, for lack of a better term or way to describe it, that's kind of shameful, guys. Take that off of your moms, but don't ignore it. Pick up that mantle. I think if we did that, I think we would really improve heart health, that approach that women take. Often what you get is this dynamic. As pediatrician, we see this all the time where the men like, oh, he's over exaggerating. There's that dynamic that the men say. And then the moms say, but you're always underplaying things. Okay. Now, of course, we're making generalizations, Patrick. Of course we are. That's right. Not always the case with every couple, so to speak. But in large part, it is the dynamic that's out there in healthcare. I had a colleague of mine, very famous. I can't tell you his name, but he wrote an article in a journal, a magazine, about how women drive healthcare. And I was joking with him when I read the article. I literally texted him and I said, "Did you do something wrong at home?" And he's like, well, "What do you mean?" I said, "Well, we all know that. Why did you write that article?" You're a guy's guy doctor out there in the media. Why did you write the article about women drive healthcare? Were you trying to, be nice to your wife for some reason? Did you do something wrong? And all I got back on the text was, shh, okay. And it was funny, but this was a very big person out there in the media advocating healthcare, admitting that the bulk of healthcare is in women's hands. And as a pediatrician, I turned around and I said, but that's, we shouldn't let it continue that way. We should learn from that. But the burden that places on women in families with, a husband, wife, or two people in the family is bad enough. Imagine a single mom in a socioeconomically deprived situation, all raising children by herself. And now she has to be completely responsible for all that because the man isn't there at all. Okay. Well, there's data on that, by the way, that in that situation, women rise to that level of being the all, mom and dad, but often they're the ones driving healthcare. And get what? Their children get as good access to healthcare as families of means with two people in the family. That doesn't tell you, that's kind of like this little data, but I always try to read in between the lines. What does that tell you? Women rise to the occasion every single time. And it also has a very strong implication of policy. We talked about policy and trying to keep young men and children and all of us healthy. Well, you better make sure that that single mom has insurance for her kids. That means today she needs a job because it's so linked to insurance. That's how our system works, for good or bad. It really requires that. So if you have someone who it doesn't have a job, that's going to affect their ability to get that proactive nature of moms won't have access to the healthcare system. And we see that. In fact, if you have a mom and a dad in a socioeconomically depressed situation and the mom isn't working and there isn't insurance, and yet there's two people in the family, a man and a woman, say in this case, they don't access the healthcare as much as a single mom who's working in a poor situation. Does that not tell you what's going on here? The dynamics of women and how they think about healthcare? You've got to reinforce. The system then has to make sure they reinforce these women so that men can stay healthy. We depend on this. We built this into the system. And I think once you start understanding that, then we've got to learn from it. Your point is well taken. Now, what do we do with that? Once we understand that, do we just say, oh, that's the way it is, and we'll just keep it going? Or do men step up and say, enough? We've got to take that burden off and share that burden and watch the model of our moms and those single moms and our moms, in general, who are telling their husbands and children to do this and say, okay, we're sorry we put you in that situation, but it's time for us who are dying faster than you are with heart conditions and earlier than you are at a rate to realize that you've done your job. We need to learn from you, and we need to take that mantle now, and we need to take control of our health. I know it sounds oversimplistic, but if we changed our philosophy as men and learned from that model of these mothers and these women, that could be a huge public health impact in terms of the outcome of diseases as important as heart disease.
Yeah, absolutely. I think then if you have everyone kind of working on prevention and being proactive about heart health, you would see those numbers in deaths per year for heart disease probably decline pretty rapidly, because then you would, it's probably going to happen, right? It is what it is, but the decline that you would see happen, I think, would actually happen really fast, because people would go in, they would be asking you, which was I'm kind of leading into my next question, but what are some good tests to get for heart health? Like, if you're generally a healthy person, and you're not seeing a cardiologist, right, as a kid or as a young adult, are there tests that you can ask for, or can you even ask for a referral to a cardiologist? Like, let's say that, like, I have a family history of heart disease, so I had seen a cardiologist early on in my 20s just to get an EKG, make sure that everything was working right, because my dad and his dad died I think my dad died in his late 50s and his dad died in his late 40s. So I mean, it's in my family, and my other side of my family actually they have really great heart health. So I kind of hope I got their genetics right.
Right,
But
right.
but there is kind of a way to combat that too. I mean, you can take up, like you said, good lifestyle habits, nutrition, laying off the fast food, exercising regularly, and the other thing too about heart disease is you think, well, I can go and I'm young, I can go eat fast food, my body processes it, but it's one of those things that's this very slow kind of chipping away. It's like water eroding at a rock. Like, you have a
Yeah,
river one day, the next you have the Grand Canyon, and
yeah.
and that's kind of how it kind of manifests itself. So what are some good tests that someone can ask for, or any type of kind of preventative modalities that you can ask your doctor for, and they can kind of send you off, go get testing, and kind of maybe even just establish a good baseline so that you can track your heart health over time?
Yeah, these are excellent questions. And again, men, boys, step up, young men particularly step up when you're in college or pre-college age, start being active. This cool mom the other day was sitting there and her son was heading for college. This was last week. Um, Very athletic young man, and he's sitting there and on the exam table, and she's on a computer working. And I'm like, is she being aloof or something? Is this mom like, oh God, this is disruptive. I got to be working here. I have to bring my son. And no, she was doing this really cool thing. What she was doing with him is I asked him a question, and he turned to her and she says, "Don't you see I'm working here? This is your visit." And she kept doing that to him. But she didn't do it in a rude way. What she was doing was encouraging him. You're going to college. I need you to ask these questions. I'm here to support you in the background now. I'm trying to release this. You answer that question. Don't keep coming to me. That was her kind of, she wasn't really typing anything on that computer. It was her body language. It was her way of letting the bird out of the nest to fly. It was really cool to watch.
That's awesome.
And I think, and then she started, she put the computer down and she was absolutely all there. She was there the whole time, but she was trying to create that proactive stance in this young man. And I thought it was super. And I think what I would do is that young man is you mentioned this already, know your family history. We keep saying in healthcare that, family history, genetics are important, but we don't spend enough time on it. I would say as doctors asking it in the history, and we don't know it ourselves. So as a young man, ask your family, what are the health conditions in our family? Know those, because in a young person, those guide what tests you do and how you do it even more than in adults. In adults, they just kind of throw battery tests at you based on age. Just there you go. Everybody gets the same, rubber stamp. But in young people, we kind of guide it a lot more. And I think we should in everyone. As a pediatrician, I would think long term, we should guide it based on what are my risk factors? Well, one, I'm a male. We already talked about that. It's a show
Hmm.
about men. Yes, being a man raises your risk factor for heart conditions, more likely to have high cholesterol heart conditions and other things than women, just because you're a man. It's one of the risk factors. Okay, but what are the genetics? In our family, first, second generation, who has what? Know that. Number two, know what your blood pressure is. Know what's normal and know what is. Know your vital signs. Know what your heart rates are on basis. Know what your blood pressures are. Know what your weight is and how that falls in, am I overweight or underweight? Know the basics about yourself. Don't just turn to your mom and go, what was my weight last time? Is that okay? Don't do that. Be proactive in knowing the basics about your own things that are intrinsic to you. How much do I weigh? How much should I weigh? Okay. Know how much you're active, not active. Know what you're eating and find out if it's good. Take a little diary, of what you eat in a week or two or a month and show it to your doctor. Say, look, does this look all right to you? I'm being honest here. I'm full disclosure. This is what I ate. Do you see a problem with that? Talk about nutrition. And then in terms of labs, the things that might then come up are things like risk factors, like the high cholesterols. Know what your baseline cholesterol is. We know that starting at 2 years old, it's been recommended that if there's a family history of high cholesterol, the kid should be checked as early as 2 years old and treated. But not everybody's doing that because it's a recommendation. Well, know that as a patient of yourself and say, hey, I haven't had a cholesterol in a while. Should I have that as a baseline? Know what your sugar levels are, and not just your sugar, but if you're concerned about your weight, what is what we call your hemoglobin A1C and your insulin levels? Do I have any sense of pre-diabetes at all? Are my organs that are vital to this and affected by weight and stuff, such as my liver and kidneys, are they functioning well? Because if my kidneys aren't functioning well, that may lead to hypertension, which is one of the biggest causes of early heart disease. So know these things. So we're talking about diabetes level checks, checking for your cholesterol, what I call the common, the common soil. These things go together. Look at your labs in terms of, in men particularly, at some point, inflammation levels, what they call cardiac CRP. These are levels which actually indicate, and we find that they are not only race dependent, but gender dependent, and they do work in young people. There's evidence now of that if there's inflammation in your body already, that sets you up for potentially having early onset heart disease, blood vessel disease. The linings of your blood vessels may be inflamed already. Those might be genetic, those might be lifestyle issues. Know those numbers, okay? And then get an EKG. We know that an EKG can pick up 80 to 85% of those people you hear in the news that collapse suddenly, 2,000, 3,000 a year. 1 out of every 300 young people are vulnerable to this. Well, an EKG can pick up the bulk of those without even laying eyes on the patient. So have a baseline EKG. I would argue, as you grow, like other countries do, elementary school, perhaps at birth, elementary, middle, and high. But if you haven't had it by the time you're thinking about it as a young proactive male, ask for an EKG. These are the things I would do.
I think those are all fantastic points and great starting points because, not everybody's the same, and we can set up a baseline. And at least if you know your baseline, you can kind of navigate the system a little bit better and then really know if something's going on or if that's just kind of how you normally are. And so
Right.
I think those are super, super important to preventing what could happen long term and preventing, harm. So kind of as we wind it down a little bit, Dr. Eric, this has been a great conversation. And I feel like you've really passed on a lot of really great information to guys. And the kind of how I'll end it with our experience in men's health is we have like a smoothie guide it's like fruits and vegetables, very easy thing to kind of consume. But we noticed when we first started kind of coming up with some smoothie recipes for general health, guys didn't care, right? We're like, hey, we have this smoothie. It'll help with blood pressure. It's got beets, celery, watermelon in it. Tastes pretty good. And there's some benefit to your heart health for all those vegetables. And you can add blueberries or whatever you want to it. And we were saying like, hey, it'll lower your blood pressure. It helps with blood sugar, gives you sustained energy. Guys didn't care. When you start to incorporate their sexual health into it and say, hey, like blood flow is very important for these reasons now, then they're like, oh, and it started downloading.
Yeah.
Right. So, and it's definitely a fact that guys and their sexual health can be a good barometer for overall health. It's not the end all be all, but what do you have to say to guys like they're, I guess if that gets you in the door, cool. But what do you have to say to guys that kind of that's like their main focus on health, and rather than really seeing it as, oh, I should worry about my blood pressure and blood sugar, and those things do impact your sexual health, but it's just kind of hard to relay that information, right?
Yeah, and I think you're right. And from a societal point of view, sometimes from a cultural point of view, and from just a kind of where you are in your maturing point of view, we're very focused in men more than women, I think, in many ways. Don't want to overgeneralize, but this machismo kind of sense of what it means to be a man. And I think we've had several guests on my podcast, and particularly a female urologist who talked about reproductivity in men, and she focuses on that. Again, a woman, and the idea was really that male fertility issues, which men have a lot of problems with, fertility issues that she's dealing with, are part of your health. And she made a good point. And I think I've since learned from, like you and I, we learn from each other. And that's wonderful about these podcasts. And hopefully our guests are picking up on this as a discussion between all of us. And we're kind of sharing our thoughts, and hopefully it just grows. And I definitely learned from my guests. And one of the things that really came out in your question that I remind her comments was that guys realize that your fertility issues are part of your health, because if you don't take care of your whole health, it will have an impact on your fertility. But taking care of your fertility will also mean that you're taking care of your health. These are connected in guys. And start thinking not sort of in your own body as a microcosm. As we say, guys' hearts are either in their stomach or lower. Don't put that there in your mindset, but think about yourself as a whole. Okay. And it is absolutely true that this has to do with blood vessel health, vascular health. The medications that we use, the Viagra's and things in the world, are all based on blood vessels, opening up and making sure the blood vessels and the flow are there. Well, of course, these things are in your heart, in your arteries, and everything. So it's your whole body. It's not like your blood vessels are only one part of your body, right?
Right.
They're everywhere. And so taking care of vascular health is part of fertility, but it's part of heart health too. It's cardiovascular. That's what they mean. So start thinking about yourself globally. I think perhaps getting back to this idea of the way women think. Women think globally. They step back. They literally see the whole picture, whereas guys kind of get focused, right?
Right.
And that's what you're talking about. And so that's a cultural thing. That's a developmental stage that guys go through sooner. Some guys never get out of that immaturity level. But I would say, guys, grow up. Let's be honest with ourselves. Grow up a little bit. Start thinking beyond, your sort of your drives and all those things, whether it's sexual or other, and realize that this is the whole. This is part of everything. If you want to have fertility and that's important to you, and that's why you're going to drink or eat or exercise or take something, know what it does to the rest of your body and understand the benefits and the detriments to it. Be careful about supplements. The whole idea of testosterone in men has always been pushing that, but then they realized it created other problems. And we talked about that on our podcast as well. So if you focus on just one part of your body, you're going to miss your whole body. And what good is that if the whole entire building collapses because you tried to fix one particular man's cave, so to speak, in the building, and you ignored the rest of the building and it fell apart? Now, what good is that? All right. So I think it is important, again, to use the construct of think globally. Think about your whole body, not just one part of it. And if it has the benefits, and I would say, real simple equation, is that good for fertility and guy things? And does it have other benefits? If it really benefits your whole body, that sounds like a great thing. Try that. Ask yourself, also be proactive as a guy. And I would say that to all patients, would say, okay, you say that is helpful. How do you know that? As a patient, ask that question. Okay, I kind of trust you. You're a nice guy, Patrick. How do you know this is helpful? What's the evidence behind that? So that you don't just accept things point blank because, oh, it can help, with me and the ladies. Yeah. How do you know that? Keep being cynical in a constructive way as well. Ask about things you put in your body, good and bad, and what the implications are. So that's my short answer to saying, guys, get yourself out of your mindset of just thinking below the belt, and think about your whole body and below the belt, and everything will do much better.
I think that's a great way to wrap it up, Dr. Eric. I mean, that was fantastic. And, there's this is probably a different conversation for a different day, but the media kind of puts that on guys a lot too, right? I mean,
Yeah.
when you see advertisements for things for men, it's sexual health, medication, or Blue Chews or whatever, not to get into brands, but you see a lot of that on TV. You see a lot of hair restoration, hair loss kind of thing. And you see a lot of testosterone. And I guess to a degree, some of those things can be great, but it's really focusing and preying on the insecurities of men rather than, actually addressing health issues, right?
Yeah.
So kind of just peel back from the media a little bit and say, okay, are these things really good for me? Do I really need these things? And, just like you said, I mean, that's a great way to kind of get started and become a little bit more proactive of your health. And, it's been a great conversation today. I think I've learned a lot. I definitely know our audience will get a lot of value out of this. And, thank you so much, Dr. Eric, for coming on the podcast and talking about all things heart health.
Well, I really enjoy always the conversations. I hope we have many more, and maybe can do some things together. But guys, I agree with you entirely. I really am fortunate to have this forum to be talking about men and men focusing on things. So thank you for inviting me to this. And guys, get out there. Show the world what guys can do, but realize we do it on the backs of those before us. And it's time for us to take some ownership for some of this. So thank you.
Awesome. You're always welcome. And we'll talk to you soon.
Stay well.